34-year-old previously healthy woman is admitted to the hospital with abdominal pain and bloody diarrhea for 3 days. She reports consuming undercooked beef a day before the onset of her symptoms. Her medical history is unremarkable. Vitals include a blood pressure of 100 over 70, pulse rate of 70, respiratory rate of 16, and temperature of 97.9. Physical exam shows paleness, face and leg edema, abdominal tenderness in the right lower quadrant. Lab investigations show erythrocyte count of 3 into 10 to the power 6, hemoglobin 9.4, hematocrit 0.45, corrected reticulocyte count 5.5, platelet count 18,000, leukocytes 11,750, bilirubin 2.33, direct 0.2, creat 4.5, PUN 35.4. E. coli O157H7 was identified in the patient's stool, which toxin is likely responsible for symptoms. So this is just a giveaway. If you just look at this one thing, you know the entire answer. Okay, so this patient with bloody diarrhea, hemolysis, AKI, Shiga toxin is associated with E. coli O157H7. Patients with Shiga toxin producing E. coli infections are at risk of HUS, as seen in this patient. The patient has hemolysis, he has uremic symptoms, and that's all you really need to be able to recognize in this question. Okay, some of these other toxins. So we've gone over these a couple of times. You need to know about each of the toxins. There is a table in your first aid, which we've gone over a lot of times. So once again, I will remind you to go over that one table, learn the mechanism of each of these toxins and what disease they're associated with. That's very high yield. It will get you a lot of extra points.
Thanks for watching. Please give a thumbs up and subscribe for more.